Hello, my name is Alan Young and I'm here at the 40th anniversary meeting of the British Association for Psychopharmacology in Cambridge, where I'm talking to Professor Philip Cowen. Phil, thanks very much for taking the time to speak to us today.
It's okay, Alan, it's a pleasure.
I wonder if we could start off with you just telling us a bit about your current job and your current role and what you do during the day, really.
Well, I'm a psychopharmacologist and I work as a psychiatrist, so I both conduct research on patients and also try and help patients, principally patients who have depression, and my principal treatment modality is using medication.
So that's the clinical side, but you're also involved in research and teaching. Can you tell us a bit about that?
Yes, I hold an MRC 5-year program grant, and that outlines a research program mainly using various brain imaging techniques to try and understand the neurobiological basis of depression and to investigate new methods of treatment.
And teaching, you're part of our university departments with, I guess, undergraduates, postgraduates and so on?
Yes, I do some medical student teaching. I'd say the main teaching I do is to try to mentor younger doctors and younger trainees who are involved in their research careers.
Okay. Can you tell us a little bit about how you got into this field of research? Perhaps go back to when you were an undergraduate.
Well, it's a long way to think back, but I did medicine at UCL. And it was possible then to do a BSc, and I did one in pharmacology. And it was about the time that the work of Les Iverson was becoming more prominent, giving wonderful descriptions of the way that psychotropic drugs used in psychiatry might be effective. And that really kindled my interest.
Of course, UCL was very strong in pharmacology.
Yes, indeed. Heinz Schultz was the professor, and extremely authoritative and well-informed man, rather frightening to be taught by, but certainly gave you a good feel for the subject.
Yes. Did you go into medicine intending to go into psychiatry and psychopharmacology, or was that something that arose during your medical studies?
I really enjoyed my psychiatry attachment.
Where was that?
Well, that was also at UCH. And rather interestingly, in those days, UCH was rather psychodynamically inclined. So that was extremely interesting. And the wish to understand people in that sort of deep psychological way rather chimed with the 60s culture at the time. So I did enjoy that.
And did you move straight from UCH to Oxford, or did you do something in between?
I trained in psychiatry at King's College Hospital.
Oh, right.
Before it was amalgamated with the Maudsley, so it was a rather separate institution in those days. Again, rather psychodynamically orientated. So I obtained a rather good grounding in that approach to psychopathology. And after 3 years there, I passed the MRC Psych. And that's when I saw that a post in Oxford was becoming available in the lab of David Graham Smith.
Now, David Graham Smith, who of course is a past Lifetime Achievement winner for the BAP, you're the current Lifetime Achievement winner, ran a fantastic unit. So he was Professor of Clinical Pharmacology, but he was very interested in the brain and neuropharmacology.
Yes, I mean, he was an inspirational character and also rather visionary. So what he did was to take on people like myself who were psychiatrists, who, as he might have said, didn't really know a neurotransmitter receptor from a chopstick, and trained us in basic neuroscience. And he trained a lot of people who went on to become psychopharmacologists and academic leaders in psychiatry. And I think actually UK psychiatry's debt to David over the last 30 years can't be overstated.
Absolutely, absolutely. Because not only yourself, but other major figures in the BAP, Professor Goodwin, Professor Nuts and so on, they all went through the same
They all came out of the same lab, and we all have enormous respect for David. And also Richard Green, who trained most of us personally, who was David's deputy director.
And over the course of time in Oxford, how has your research changed and evolved?
Well, I started working in David's lab, so I learned something about basic neuroscience. And David was very keen on translational work, even before it became a well-known term. And what he encouraged us to do was then to find a psychiatric problem where we might apply the basic neuroscience to try and improve understanding and treatment of a particular clinical area.
And you've collaborated very widely, haven't you? You've got collaborators not only within Oxford, but also out with. I mean, do you think that's a good approach to these problems?
I think so, because these are rather complex areas involving basic science, clinical psychiatry, and to be able to put it all together, it's really helpful to have experts in other areas. That's one reason why I found working via the BAP very helpful. It enables you to make extremely good contacts with people whose interests and values are rather similar to one's own.
Sure. When did you first become involved with the BAP?
Well, I think David Graham Smith's lab and also Richard Green were always keen to be part of the BAP. And so one of the things we did when we started working in David's lab was to attend the BAP meetings each year. And David and Richard always thought it was important that we presented our work. So that started really probably in the early 1980s.
So that's quite a number of posters, lectures, and so on over the years.
Indeed.
Yes, yes. And of course, it's back in Cambridge. And we haven't been in Cambridge for a while, but there is a real memory of the old days when the BAP was always in Cambridge. Right?
It's a wonderful setting. It's a lovely city, and the meetings here are always very well attended and educationally of a great standard.
So this is the 40th anniversary. I'd just like to ask you about the future, firstly, of the field of psychopharmacology. Where do you think things will be in the next 10, 20, 30 years?
Well, I think that basic neuroscience has made so many strides forward. You feel inevitably it's going to feed through into improved treatment for patients. I think clinically we need to raise our game so that we're more able to embrace these discoveries, and there's a lot of discussion about whether current diagnostic systems really enable us to make the full use that we might of the basic neuroscience advances. So generally I'm optimistic. I also think that we understand more about the brain basis of our disorders now with neuroimaging. And in a paradoxical way, that might lead into improved psychological treatments just as much as pharmacological treatments. The new ideas about brain training and neuroplasticity seem to offer really great opportunities for that, for therapies based as much on learning and experience as on drugs. Though I'm sure we'll go on seeing them both combined as they are at the moment.
And of course, we may well have drugs which enhance learning and enhance neuroplasticity to allow our brains to change.
Yes, exactly so. And that approach should be extremely interesting, things that can really enable the process of learning and changing to go forward.
And the BAP, how do you see that for the future?
It's a great organisation with a long history now. And what's particularly encouraging are the young people who attend, both scientists and psychiatrists. They seem extremely intelligent, highly motivated, and very keen to make a creative contribution to the field. So that's another reason to be optimistic for the future.
Professor Philip Cowen, thank you very much.
Thank you, Alan.